on this episode of A Tale of Two Hygienists.
It's really my focus now to keep seniors healthy longer so they can stay in their communities, in their homes, lively and viable, vibrant members of society instead of being an afterthought or an insignificant part of the community. In clinic, as you're seeing aging patients, to really talk to them when they're saying, I think I'd rather just watch that. I know that there's some decay under that crown. The dentist is maybe treating it conservatively. I would start to think more forward-focused on what that's going to look like 5 years from now, and the price is going to be more. They're going to be probably less comfortable in the chair, and really persuade them to think really proactively in getting themselves up to tip-top shape and getting going on really great preventive adjuncts.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 448. My name is Andrew.
And I'm Annie.
Hey, Annie. How's it going?
It's going well, thanks. How are you?
I'm doing good. I'm pretty fired up about these next couple of episodes.
Great.
And every time we schedule these chats to do the intros, I'm like, dang it, Annie wasn't on this one again.
I know. Like, we just have to get through it.
Yeah. So sorry, but
no,
I mean, they're really good. But the cool thing is, so on the podcast episode today, we talked about this a little bit last week, but it's Debbie Lindell, or Deborah Lindell, and she is talking a lot about brain health, and there's this gap in kind of the healthcare system, medical, dental. We don't really talk. Then there's all sorts of it. I won't talk about all the stuff she's going to talk about, but she goes into it quite a bit. One thing I do want to point out for the listeners, and I know I come back to this regularly, but I feel like it's just a resource that's not utilized nearly enough, is the fact that we have show notes. So Debbie spent some time, composing this email to me for afterwards, and she sent me a bunch of links and a bunch of ways to contact her. And then also we just talked about other things that just random things. I said, okay, I'll link that to the show. There's another podcast episode that we talked about, and so that'll be in there. So listeners, be sure to just click on the episode title, usually in your podcast player, and it'll come up with these show notes, and there'll be a lot of resources for you on this particular episode. So make sure you utilize them if you're interested in this topic. And then next week we have Jamie Britt on the podcast. Jamie, she was on at Voices of Dentistry. I want to say it was 2023, so just not this 2024, but the year before. And she's been on this health and wellness journey. And it's been interesting too, because I saw she posted again this weekend there's a picture of a before and after. And she was never terribly, terribly out of shape. But I think the thing I was trying to get out of her in this episode was, okay, you went from an area of not being super healthy to an area of being pretty darn healthy. But then you realize that's not really health. What you were doing, okay, maybe your body looked better, but that wasn't still health. And then you made another change, and then she made another change. And she's doing these pivots that have been increasingly healthier for her, both, mind and body, spirituality, all the different things. We are going to get her on another episode. We're talking about jujitsu, which is just something that just fascinates me. But that we didn't talk about that on this episode, unfortunately. But, it's just a fascinating episode that, even if we look, if our bodies look good, we can still be unhealthy. And, it's kind of this journey that, we always kind of have to go through. So that's a really good episode for next week, everyone. Just make sure you hit that subscribe button or that follow button on Apple Podcasts, and make sure you don't miss that one. But that's going to be a good one. Annie, let me ask this though. Okay, do you actually listen to the podcasts that you miss, or is it too painful?
Sometimes I just, it's painful in the sense of listening to your own voice. You know what I mean? I don't
really,
it's helpful, but it's not painful in the sense that I FOMO, fear of missing out. Of course I have FOMO, but sometimes it's just hard for me to listen to my own voice.
Yeah, no, that does get. I'll say it does get better, but it doesn't really. But like I'm gonna come on the same boat with you. Is like
Yes.
It's weird because you like in your head, I'm like, okay, well, I have like kind of more of like a bass voice or whatever.
Yep.
But then when I hear, I'm like, oh no, you're speaking out of your nose. Like that is nothing but
Yeah.
like, dude, go blow your nose first before you get on the podcast, and then see what happens there.
Yes.
And it's like also I'm like kind of breathy when I speak. I'm like,
Yeah.
oh my gosh, well, anyway.
It's valuable. I mean, it's learning things, but yeah.
No, yeah, there's always good ones to go back to.
For sure.
The only thing I want to talk about before we throw it to the interview, though, is the Olympics. I was just telling you beforehand that I had probably the best like 24-hour segment I've had in a really long time. A lot of it has to do with sports and the Olympics and things like that. What have you been watching them?
Yes, the Olympics have been so great because I have just had a baby, and so I've just been hanging out, taking care of the baby, watching the Olympics.
I bet. Okay, hold on. What's the time difference for you guys? It's
3
not quite
hours.
12 hours, right?
Oh wait, between you and I?
No, between you and France.
Oh, I have no idea.
I mean, but it's significant. So was stuff coming on pretty early in the morning for you? It's like you could,
Yes, it was. It was like very early in the morning. Yeah.
Yeah. So I bet if you're up with baby,
Yes,
like,
it's
okay, let's watch some.
Yeah.
What sports do you prefer? You like the track and field stuff, or like the swimming, or like the
definitely
ball
swimming.
sports?
I was a competitive swimmer for a really long time, so I always
You were?
yes. And so I always watch swimming. Gymnastics I watch for sure, and then volleyball because one of the beach volleyball players I went to high school with. And so
Who are you even?
I know. So I like
No,
get
that
so
makes a lot more
stoked for
sense.
the Olympics. Yes.
Because we were talking before, and like you knew all of these sports things. I'm like, you like
I
you
love
know sports.
Yes, I love sport. Love sports movies. Like I love it. I love it all.
Annie.
Yeah.
Oh, our listeners are gonna hate that. Sports are gonna start creeping into the conversations.
Yes.
Do you have a favorite Olympian that's not like someone you went to high school with?
I don't know if I have like a favorite Olympian. I mean, watching gymnastics, I feel like it's just mind-boggling to me, and those athletes are just absolutely incredible. So
Yeah, I mean, and longevity is like, it's kind of like pro sports, and a lot of times like they're 1 or 2 Olympics and then they're out, and
They're
then
done,
like Biles is still in there, like just like she keeps chipping away. I'm like, dang, like, and she's not that old, but like she's been doing it for a really long time.
really, it's like their whole lives. It's just crazy.
I saw this one clip, and I'm not going to add it to the show notes of this one, but I did see this one clip of this guy. He was just doing like I don't know what they call it, but they're like, it basically like a tumble, but it's like a one-off. It wasn't like a floor routine or whatever.
Yeah.
And all it was is flips over flips over flips and like multiple and I'm like, how are you? This is incredible what these athletes are doing. It's otherworldly what's happening.
It is. That's what I feel like too. When I watch them like do all their different events, I'm like, how are you? It is. How are you able to do that? How can your body physically do that?
Yeah. If we were to have a dental Olympics, what would be a sport that you think that we should include?
A dental Olympics. I'm trying to think of maybe something around like polishing or like air polishing. I don't know, but I don't want to do anything like who can do something the fastest, because then that makes me think it's not efficient.
No, but I mean, I think that's the thing. Like we have disclosing agents, so you can like disclose, and then who can remove all this the fastest and the most efficient, and then you get deductions for missing spots and things like that.
Yes. Okay. There we go. Okay. Yes.
But
that's good.
No, I was thinking like, I mean, for like the doctors, of course, obviously there's restorative stuff that you can always do as well.
Totally.
I think some sort of like acrobatics around someone's tongue and big old fatty cheeks and things like that, or the person that can't lay back, or I don't know.
We see all those memes.
Yeah. So anyway, all right. Well, I mean, look, I love the Olympics too. I like. I am, by the way, a summer Olympics as opposed to a winter Olympics kind of guy.
Same. Yeah.
But I mean, it's just nice. I like the basketball teams. I'm really proud of. And I'm actually really interested in see what 2028 brings as far as basketball goes, because we had a bunch of old people on the team.
There were, yes.
And so it'll be interesting. And I'm on both teams too. And so it'll be interesting to kind of see like what the new young crop is. I was having a side conversation with a friend. I'm like, there's no LeBron or Steph or KD coming up.
Right.
And so I'm like, there's good players, but there's no that level players. And so I think there actually are. But I just, obviously.
I think that also like applies to other like Simone Biles and all these different athletes that are like one, and like, I mean, it's just, when are you going to see that level of athletic ability again? I don't know.
Yeah, who knows? And you know what? That's the thing though. Having like Simone, for example, having her in the doing this for so long, there is probably so many people that have been influenced to like, oh, I want to be Simone when I grow up. So, I mean, I guess there's, hope,
She's a great
that
figure.
there is, more people in the pipeline. But
Absolutely.
anyway, awesome. Well, great chatting, everyone. I know you're really going to love this episode with Debbie Lindell.
A tale of two hygienists.
Listeners, welcome into the interview portion of the podcast. I'm joined today by Debbie Lindell. Thank you very much to Debbie for being on the podcast.
Thank you for having me, Andrew.
So first of all, I would love the listeners to get to know you a little bit more. So do you mind going into where are you coming from in dentistry and what has been your passions?
Oh, I would love to. This is my 41st year in dentistry, starting out as a dental assistant for 10 years and knowing there was something more. So I've been a hygienist since 1993. Even then, my passion starting back in 1983 was the geriatric sector. And in my mind, I just looked at that as the aging community. I've now learned that being geriatric is more than just being elderly. It's having systemic issues. So tying in as a hygienist and trying to eliminate disease and keep people healthy, it's really my focus now to keep seniors healthy longer so they can stay in their communities, in their homes, lively and viable, vibrant members of society instead of being an afterthought or an insignificant part of the community.
Later on, we're going to talk a little bit about the system and how it's broken and some things that, just other things. But kind of right off the bat, I do have kind of a question about your experience. So earlier in your career, when you're working with the elderly, we'll say not the geriatric, but the elderly, are you seeing a huge difference in the elderly population now in how they're manifesting with whether it's systemic issues? Is there more systemic issues now than ever? Or has it kind of been the same issues, but they were maybe undiagnosed before, but now we have diagnoses for them?
Well, that's an interesting question and multifaceted. I think we are a larger, older community, so we see more things, more patients, more things. We're focusing more on health. So I feel like more, I'm going to call them seniors, are coming into the dental offices to try and stay healthy. I see them making good choices. And again, I think less than 50% of the population even goes to the dentist. But those patients that I've seen want to be healthier. They're open to receiving information. But there's a lot of sugar. It's just everywhere. And they think they're making healthy choices. And I see that being a problem. So I absolutely think that people have more disease. I do think it's linked to sugar, honestly.
It's interesting that you say that. So, well, our common connection is Tim, of course, Tim Ives. Tim, so everyone, we are at RDH Under One Roof recording this episode. And Tim, this time last year, did that whole episode on sugar. I'll link to it back in the show notes, everybody, so you can go back. It was a very powerful, very amazing episode. But it really is talking exactly what you're saying. Sugar is this culprit. And I don't really want to go down that aisle today, but I do think it's something that's worth revisiting. But if we can quickly touch on that, you said that they're trying to make good choices, but sugar is still the problem.
Exactly.
So how are they making good choices if sugar is still the problem?
They're trying to exercise. They're trying to keep their mind healthy. They're trying to stay on top of dentistry. They're doing fluoride treatments, and they're really receptive to what else can I do at home, like adjuncts, like how to manage the bleeding and the inflammation. But I see the sugar components, they're still getting decay. They're frequently on a fixed income. Insurance, as we all know, doesn't cover much. And they have a lot of recession. As you're getting their gums healthy, there's a lot more tooth above the gum line and its root surfaces. So it's a really vulnerable structure. And, it's disheartening for them and for us as hygienists because it's just a never-ending problem. And I sometimes think that scares them. It makes them more nervous about going to their regular checkups if every time they go, they have new expensive treatment needs. So it's frustrating for them. It's frustrating for us.
I don't remember what the phenomenon is in the world, and there's a term for it. Maybe you know it, maybe you don't. But there's when you just learn about something, or when you hear, like, you just paid attention to this one thing and all of a sudden you see it everywhere in the world. This kind of topic is, I just heard it on this podcast, and listeners, I'll link to the podcast in this. It's called My First Million. But in it, they talk about the fixed income issue that you were talking about, how the options for those on fixed income for food, for quote unquote nutrition, the nutrition quality is terrible. The cheaper products are refined sugar, simple carbs, all the different things.
Yes.
And that is what our seniors have access to.
Right.
And the marketing, unfortunately, is we are healthy because we don't have whatever in it, but really they all still have any nutritional content in it as well.
Right.
So these I don't want to say the poor susceptible people, but the people who are well-intentioned are being misled by kind of deceptive tactics. Again, I don't want to get into the whole, big sugar is a big problem, but
right.
But I'll link to that in the show notes as well, listeners. It's a really good episode. It's a little bit longer, but it's a really good episode. But I do want to talk a little bit about brain health in general, and just kind of like starting on your journey of, I guess, discovering the problems and like kind of what we're seeing right now.
Okay. Well, so 2020, March 17th, I stopped working because of COVID and waited 5 months to go back to practice at the office I was working at, because he was trying to be very cautious. And 1 week went by and I was like, that's 40 patients I didn't see, and then 80. And then, I was just thinking, how am I going to get them healthy again? Just there wouldn't be any openings for them. But I really was thinking about people in a memory care facility just up the road. And I thought I could go there and I could help those patients, or residents rather. I miss patients, right?
Yeah.
And so I helped them with their brushing. And they were very receptive to have me there. Really excited. And in fact, they were like pointing, what about this tooth? And I need a root canal. So
it's cute.
But the first person that I saw there was 98 years old. She opened her mouth and she had a draining fistula. She had 5 teeth broken at the gum line, and she had rampant decay. She had some third molars too. She wasn't seeming in pain. I brushed them. They bled like crazy. Clean in between with a Proxa brush, and then immediately reached out to her caregiver. They got her to a dentist. They put her on an antibiotic, and that was the end of that. They didn't address any of the other. So that was alarming to me. I didn't really understand that. Is that a COVID thing, or what was that? But I realized the pattern of everybody I saw having these issues, and they were fee-for-service residents. They paid $8,000 a month to live there. So they had beautiful dentistry.
Yeah.
And all of their teeth or bridges are, fully restored. And I just saw this inflammatory issue and the buildup, and I knew their health histories. Artificial joints. They had kind of the garden variety of high blood pressure and diabetes, and
sure.
But I was just really alarmed and concerned about these other health conditions, knowing the connection of their mouth and inflammatory issues. So I've tried to create a program where I could go in and train the staff members. And while every facility has seemed really excited and open, they needed to pass it up to somebody higher up. And it's kind of I'm sorry to go here, but in my mind, it's like the ADA and amalgam fillings. We're still doing them. MA, continues to pay for them. I don't think there's ever going to be a time where they can say, oh, we made a mistake, because they're continuing to go down this road.
They'd be accepting liability for all of the decades and decades of doing it.
100%.
Yeah.
And I feel like that's what I'm seeing now with this best practice gap, in that the facility thinks it should be up to the families to deliver it.
Sure.
And the families think, I'm paying $8,000 a month.
That
I think you should be doing it.
Yeah, exactly.
Or they just don't realize there's never been a conversation, because it's really not even on the intake forms. It's never addressed. How are you going to manage this?
Right.
And then they have memory issues. It's not like the residents living there are going to remember, or maybe even realize my mouth is not clean. And I also saw them puddings and jellos and applesauce and goldfish and juice, lots and lots of juice. It's readily available, and in some facility, I've stopped at different ones, like in California. I've been trying to gather information of what is your protocol for dental.
Yeah.
It's just it's a dark area. All they really want to know on the intake is, do they have removable appliances?
Do they plan on helping care for those removable appliances?
I think they just want to know if they have them. Maybe so if they disappear.
Like a choking hazard maybe or something?
I'm not sure.
Well, that's interesting because I remember, even back in school when we went to the facilities, we would look and we'd go in and there was just, everyone was neglected, and it was dentures left in for months on end without not removing nightly and all these different things. And it's just, do you feel like this gap, I mean, and I don't want to, I guess, put all of, the eggs in one basket, but like, whose responsibility really is it? Do you feel like it's the caregivers because they are healthcare providers and they should be more either pushing the family or pushing their facility to do more, or is it more on the families that are being neglectful in the situation, do you feel like?
I feel like it's neither. I feel like it's got more to do with like the CDC, and they define like best practice. So if everybody thinks they're doing best practice, but they don't know what they don't know.
Yeah.
I mean, a family member isn't going to necessarily be very good at brushing their loved one's teeth. They've never done it before.
Right.
They just have never even considered that. And then same thing with the caregivers at the CNAs or whoever that is, making $13 an hour or whatever, and understaffed and huge turnovers. They're just trying to stay afloat.
Yeah.
And they didn't go to school for dental care for a good reason, probably. It's just so I think there needs to be standards established like this has to happen. This isn't negotiable. And then the facility has to figure it out with the families. There's a whole host of paperwork and conversation when their loved one is entering this locked-in facility, never to leave again. That should be part of it. And, maybe it's dental, but it can't be a dental responsibility because we don't necessarily even touch those people. Like,
we don't have access necessarily in the same way.
And know that they even entered that.
Exactly.
So it's actually my heart's passion, and I am currently creating something that's going to be really fabulous that will branch out ultimately to the nation, just as a change in the way that we're doing things. And it's going to start with people from 18-year-olds to end of life, like making good choices.
Do you want to talk about that now, or is it too early to talk about it?
It's too early, but it's something I'm really excited about.
So I'm thinking about, in the best of all scenarios, yes, we would get, standardization, we would get, regulation, we'd have all these things. Knowing how bureaucracy works, we know that's probably either one, not going to happen, or is way down the road, not in our immediate future, at least. So let's talk to the hygienists a little bit. Let's talk about what they can do in the meantime. They're busy working their private practices. They're doing their what they think is their responsibility. How can they participate though in, maybe not participate, but how can they help with solving some of these issues?
Okay. Well, I know in long-term care facilities and nursing homes, they don't have a dentist, linked onto that. I also know that Delta Dental is sponsoring a program that's being rolled out very soon, I think this summer, that has to do with training whole teams, dental teams and their hygienists, so that they can go into these facilities and really get something going. So it's state by state for what a hygienist is capable of doing. I would say in clinic, as you're seeing aging patients, to really talk to them when they're saying, I think I'd rather just watch that. I know that there's some decay under that crown. The dentist is maybe treating it conservatively. I would start to think more forward focused on what that's going to look like 5 years from now. And the price is going to be more. They're going to be probably less comfortable in the chair, and really persuade them to think really proactively in getting themselves up to tip-top shape and getting going on really great preventive adjuncts.
At what point is, and this isn't necessarily a hygienist, but this is like maybe the dental professional or maybe the dental office. Let's say we have a patient in that same scenario that has an area that's like, I don't like using the term watching. We're going to watch this decay or whatever. Yeah. But let's just say that there's an area of concern, and we know that in the next couple of years it's really going to be an issue. How much do we push? How much do we push that they're brought in by either a caregiver because they're in a long-term care facility, or a family member, because that often happens as well, as they check that their family member out and they take them to the doctor, the dentist, whatever. How much do we push? What can we do to like emphasize how important this need is?
I think we push like we've never pushed before. It's moving mountains at this point, because especially that generation is used to treating things more conservatively.
Sure.
But just the reality of are they really thinking that they'll be able to stay forever in their home and live the life they're living, brushing? I mean, most everybody that age has already watched sisters, brothers, parents, and how that ended for them, and just cognitive dysfunction. I mean, it's going to happen. If we live to be 100, arthritis, dry mouth, the medications that we take, things change. And it's sure a lot less costly to grab the bull by the horns then and resolve it. But you have to have your doctor be on board with that too, because they probably don't feel as comfortable just laying down a big treatment plan that's really necessary.
I mean, and I would also say, I worked with a doctor who was not a young man himself, and we often saw people from there's a multiple long-term care facilities in that little neighborhood area, and they would come to us. We're the closest, and so it just made a lot of sense. And there were times, you're right, he didn't want to do giant treatment plans because, one, he felt bad about having them pay for something that, with life expectancy being what it was, like, okay, is it really going to be that beneficial to take all of this money? And he felt guilty about that.
Right.
But at the same time, he also, and I'm probably projecting some feelings on him, so I apologize if I misread the situation, but I would also feel like he felt like kind of a little bit of a kindred spirit with them. And he's like, okay, I'm not too far from this. Mm-hmm. I don't want to be in this situation myself. And I do feel like the doctors do have a little bit harder of a time with that than I think than hygienists and nurses probably are in the same category as us, where we're a little bit more, proactive and not just trying to like treat. We're trying to prevent.
Right.
Right.
Yep. Well, yeah. And we spend so much time with those patients and educating and seeing it. I think that the hygienist can help get the doctor to be more congruent in that we're going, oh my goodness, there's decay starting here. It's a big deal, and treat it as such instead of, oh, there's a little breakdown here. It's a gas situation, because if it starts in one spot, it could start everywhere. Something is causing that to happen, and it's not going to stop until we stop the decay and then address the cause.
I have two last questions for you. The one thing I want to tackle right now is more home care options that we can recommend, that we can really insist on for these patients. But then secondly, I'm really curious, because we talked about this off air before we started, but there's been more and more courses that have to do with brain health. And if you have any resources or places for people to go to learn more about it so they can get that feeling of, I need to be more proactive about this situation.
Sure. Well, I would say Alzheimer's.org, because that's just the reality of what that is. There's a huge link to brain health and gut microbiota, which again ties in with sugar and even artificial sweeteners. I would reflect back to Tim Ives' sugar article too, because I think he does touch on that, and he is an amazing resource.
He's so good at that. Yes.
Yeah. Let's see.
And then home care.
Home care, I would say absolutely. Thank you for that. But managing the biofilm, a water pick, something that you're really flushing those pocket spaces out of the damaging bacteria. We know that's a fact. And waterpick.com, there's just a lot of resources there. And the other thing my favorite, and it's been around forever, but not a lot of people know about it, is the sulca brush. It feels good. You can do it in the car. It takes a minute. You can do it by the TV, but just gently massaging that little pointy brush up at the gum line and just a couple swipes back and forth on each tooth, and notice where it's tender and look where it's bleeding. That's a wound. It's an injury, a wound inside the mouth. And if you had it anywhere else on your body, you'd probably put a Band-Aid on it. But within days, a couple days, 3 days, they can tell where that bleeding, that source of inflammation or infection of the gums is, and manage it. I'm a fan of like a visible, where you can tie a visual to a feeling and a taste, and it's a no-brainer.
Yeah.
So I love the sulca brush, and that's readily available on Amazon.com. No plug.
Yeah, we'll put a little referral link right. No, but you're right though. That is something that to be honest, I even forgot that was one of our tools.
It's magnificent.
Arsenal. Yeah, that's great. So people are probably going to want to reach out to you. They're going to have some questions for you. How might they find you?
I would love that. I am getting my LinkedIn and Facebook and YouTube up and running. I do have sites that I'm not super active there, but my email is I've got your plaque at gmail.com. No apostrophe.
And listeners, I'll make sure I put that in the show notes. I also, before we end, I want to give a special shout out to Tim and Tricia at O'Hare University for connecting us. Do you mind just really quickly like talking about what you're doing with the university, like what your experience has been so far?
Oh, my experience has been amazing. I meet every Sunday morning for an hour with Tim and Tricia and 3 other classmates who are in different states, who are in different countries. And this is the first time we've met in person, even though we completed our Bachelor of Science through them that focused a lot on behavioral health changes and coaching. And then we have 3 certificates, and we have 3 more months of our final one that's on really just presenting, wrapping everything up for our master's degree. And it's been amazing. We're all doing something really different, really impactful, make a big permanent print on the world as it relates to healthcare. Yeah, and I'm focusing on managing older adults as they transition, before they transition into memory care or long-term care facilities specifically.
I love that. Your class is so amazing. And thank you, seriously, for putting in the work. It's going to lead to future generations. Of
thank
things.
you.
So,
I appreciate that.
Thanks
Andrew.
again for being here.
Thanks for having me.
Yeah, this is a tale, oh yeah, a tale of 2 hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of 2 hygienists.